Hi, this is Korey with Align Therapy, and in this video I just wanted to answer a question that I often receive from patients or prospective patients. We do a lot of free consultations here in the clinic, both in the clinic and over telehealth appointments. And we've recently, in the past couple of years, received more and more requests or consultations from people that are not in the state of Utah where our practice is located, and really ranging outside of the U.S. to different countries across the ocean. And due to PT contracts and other laws, we aren't able to treat them, but we want to offer them an opportunity to be treated by someone who is certified in Schroth. And so I wanted to make a video on how you guys can find a resource that's useful for determining who might be nearby that can provide those services. So what you do, I'm going to swing you around here to my computer, is you go to this website. We're going to put this in the link below because it probably isn't going to be viewed, but it's schrothbarcelonainstitute.com. You're going to go to their webpage and you'll swing all the way over here to resources. And then you're just going to scroll down to Scoliosis PT Directory. Now this is for PTs that are in North America, and it's by state. So if you're in a state outside of Utah, I'm pretty sure that all 50 states are represented, or close to 50 states are represented. And when you go through this list, let's start with California here. You're going to notice that there's the name, their contact information, the clinic that they're located at, in the city. Next to their name is going to be an initial. It's going to say, this one says L1, this one says C2. I'm sure there's a C1 in here. Yep, C1. And these are the different certifications that are available through the Schroth Institute, or what's now known as the RIGO method by BSPTS, which is based on Schroth. And so what does this mean? Well, when you look at this and you see L1 or C1, that means that they have gone through the first certification course for treatment of Schroth for adolescents. If you see C2, they have gone through a second certification, and that's usually 1, 2, or even 3 years after the first certification. And they've received training, a review of treatment for those that are adolescents with Schroth, but also adults and post-surgery. And so what that means essentially is that a C2 or an L2 is going to have more experience. More experience both with learning the material, practicing the method, but also time. So what I would do when you're contacting these clinics is I would first look at, okay, that's a C2. Well, when did they get that C2? Was that 10 years ago? Methods improve over time, they evolve. And so I would ask when they were certified. I would also ask, what's their patient caseload? How many scoliosis patients do they see on a regular basis? Because if I was certified, but I see 2 patients a quarter, that's not a whole lot of practice with using the method, first of all, but also with just being as efficient and proficient with that method that comes from seeing a higher volume of patients, a higher variety of curve types and age groups, because they all bring their different challenges. And so I would ask about their caseload. For instance, at our clinic, about 40 to 50% of our patients each week are scoliosis. We see it every day. sometimes all day. And not to pat ourselves on the back, but that does mean something. We see it a lot. And I think that allows us to keep a fresh perspective on current practices for treating scoliosis, what works, what sometimes doesn't work for certain patients and age groups. And so those are some key things that I would ask when calling a clinic. So again, you can look at that directory if you're in North America, and if you can, try and get someone that is first or second level certified. And also call the clinic. Get a feel for them. Get a feel for how many patients they see, how comfortable they are talking about Schroth with you. And I think that will help inform your decision on who you might want to go with. And hopefully you'll find someone that's close to you. If you have any other questions about Schroth, about what it is, how it can help you if you have scoliosis, whether you're an adolescent, whether you're a teenager, younger than that, older than that, we'd love to have you check out our website. We have plenty of blogs that touch on the subject and other subjects. And if you want to talk over the phone or even telehealth, I'd love to talk with you and consult if this is something that's right for you. Thank you.